We have another a great panel to start off after that really interesting keynote. And so I'm really pleased to be moderating. My name is Catherine Laporte-Oshiro. I'm a visiting scholar here at IIUP. My work focuses on U.S.-China trade relations, but I'm very excited to be moderating this panel on a very important topic, infrastructure, environment, and growth. And we have two distinguished panelists that I'm pleased to introduce. First, we have Shanjun Li, who is Associate Professor of Environmental and Energy Economics and Sustainable Enterprise at Cornell's Charles H. Dyson School of Applied Economics and Management. He's also the co-director of the Cornell Institute for China Economic Research, very apropos today, and he's a faculty research fellow at the National Bureau of Economic Research. He has a PhD in economics from Duke, and his research has touched on the environmental, economic, and social aspects of development in China, from the adoption of electric vehicles in China to energy markets to the Beijing subway system. And today he's presenting on air pollution, health spending, and willingness to pay for clean air in China, which I'm sure many of you have been to China before. You know this is an important issue. And so we're excited to have his presentation today. Simon Alder is also presenting. He is Assistant Professor of Economics and a Kauffman Family Global Fellow at the University of North Carolina at Chapel Hill. He has his PhD in economics from the University of Zurich, where he received the university's annual dissertation prize. He is presenting today on political distortions and infrastructure networks in China, but his research has touched on areas from climate change to trade to ethnic conflict. So very excited to welcome them both today. They will each be presenting for 20 minutes, followed by 5 minutes of Q&A. And so without further ado, I'll let Shanjun come. Thank you.
All right. Good morning, everyone. And thanks, Catherine, for the nice introduction. And thanks to the organizers for inviting me here. So I'm Shanjun Li. This is a joint work with my colleague Paula Barwick and two of our doctoral students. So we are going to talk about air quality and health impacts of air pollution in China. So you might think this is really big departure from what Shanjun talked about in terms of trade and labor market. But I want to actually pose a question. Actually, this is a question being studied by a lot of economists as well, thinking about the relationship between trade and environmental quality, something that I won't talk about, but that's really underlying the air quality in China and the US, actually. It's a very important reason for why air quality in China is so bad and why we see dramatic improvement during the last 40 years in terms of air quality in China. Part of the reason is trade, as I mentioned. But the focus today is really understanding the health impacts or the environmental benefit, the benefit in environmental regulation in developing countries, in particular China. So why we are interested in this as economists, because the cost-benefit analysis. This cost-benefit approach, as most of us know, is really the dominant framework for thinking about regulatory analysis, not only in terms of environmental regulation, food safety, all types of regulations. And the benefit of environmental regulation is mainly about human health. So if you look at the developed countries, and there are a lot of studies that try to understand the impact environmental quality. As a result of those studies, US EPA, for example, Environmental Protection Agency in the US, started to regulate air pollutants such as PM10, particular matter 10, in 1987, and PM2.5 in 1997. So I'm not touching anything here. Okay. All right. I don't know what's maybe some of the connections. I don't want to touch it, but let me continue. But if you look at developing countries, there is really a lack of systematic evidence of health impact, as well as consumers willing to pay for clean air. Rather, when you look at developing countries, when they do cost-benefit analysis, they use this approach called benefit transfer. So they basically take the existing evidence in developing countries and apply them to China, India, and thinking about the benefit of environmental regulation. And of course, you might have a concern, there is a valid concern about external validity about that approach, because if you're thinking about the benefit of environmental regulation in China, India, you might think those benefits might be different from the US or UK, other countries, because differences in baseline health conditions of the population, because the differences in healthcare access. Okay, and it's also important to really understand the impacts air quality or water quality, for that matter, in developing countries, because these countries are experiencing the worst environmental degradation, and they also have a large population, and as well as the lack of access to adequate healthcare. Okay, so that's really the motivation why I want to study the impact, in particular for China. So now, given the audience, I'm going to spend 30 seconds on PM 2.5. PM 2.5 is particular matter that are really, really tiny. They are less than 2.5 microns in diameter. So this is a human hair. PM 2.5, they are about 1/20th of the human hair in terms of diameter. Okay, they are really small so that they can penetrate deep into lungs, and the toxin, as a result, can migrate to organs and cause all kind of issues: heart attacks, stroke, respiratory problems, and even low birth weight and preterm delivery. Okay, so there are a lot of studies in epidemiology on those health consequences. Okay, so this is a map of population average PM 2.5 in 2015. So these are the colors represent the level of pollutant. I want to mention that World Health Organization standard for PM 2.5 is 10 unit micrograms per cubic meter. And based on this standard, 92% of world population live in places where these standards did not met, is exceeded. China's national average is 56. You can look at this map, you see most polluted areas are North Africa and the Persian Gulf, but these really mainly due to sand dust. If you look at other areas, Central Africa and Southeast Asia and China, you see there are also very bad pollution. Those are really mainly due to human activities. Okay.
WHO standard is special to become unhealthy?
Threshold below which there is no strong evidence that PM 2.5 is causing health issues. Okay. So yeah. All right. So now air pollution has many different impacts. One is on mortality. Okay. So there is a very influential study that look at the global burden of diseases, look at the mortality by different causes. So the study shows that exposure to PM 2.5 is a leading environmental risk factor for mortality. In 2015, they accounted for 4.4 million deaths. If you look at the causes, the top number one is high blood pressure, smoking, but ambient particulate matter is number 5. So it's a very important contributing factor to mortality. Okay. Okay, that's mortality, morbidity. So these are the really health costs in terms of sickness. So there's a study from OECD. They estimate the annual health cost from air pollution in the world in 2015 was $21 billion, among which 10 billion was for OECD countries and about 3 billion for China. So again, the approach they use is this so-called benefit transfer. They use existing evidence from developed countries, apply those relationships between pollution and health outcomes to China. They got about $3 billion for China. Our study is going to show that this number is a gross underestimation. So our estimate actually is a factor of 20 compared to their number. Okay. So that was a question, Shanjun? Yeah.
Since OECD has clean air, why does it have such a large number from smoking?
These are actually air quality, not about smoking, ambient air quality. That's a good question. If we argue that this number actually for China is underestimated, okay, because they
You're losing labor hours are worth much more in the OECD.
That's true as well. But because they directly use the relationships in these countries to China, they actually underestimate the impacts for China. Okay. All right. So the objective of this study is we're going to quantify the short-term and medium-term impact PM2.5 on health. And this is, we believe, the first really comprehensive analysis in a developing country. And we are going to try to do a really good job in thinking about the causal relationship between air pollution and health, not just association. Okay. And we are going to provide also a lower bound estimate of willingness to pay for clean air in China, which can be direct input into cost-benefit analysis for environmental regulation. Okay? And we are also going to study the avoidance behavior in the short term and long term, but I'm afraid we don't have time to go into that today. Okay, I'm going to skip the literature, talking about the data. Okay, so this is average PM2.5 during 2013-2015. Not surprisingly, you can see the air pollution is really worse in this part of China because of the large manufacturing base. But unfortunately, this is also where the population density is high. Okay, so if you look at the level of these dots, these places, Shanjun and Hebei, there are over actually 90 units relative to the 10 units that I mentioned, the WHO standard. Okay, so this is daily data for these 3 years. So they go up and down there. Air quality tend to be worse during winter because of heating. But this red line here is US EPA daily standard. Daily standard is 35. That's lower than annual standard of 10. Okay. Okay, so that's air pollution data. And then another data set that we have is consumer spending data. So we have access to the universe of transactions for credit card, debit cards in China. So this is huge data set. It covers, of course, a very broad population base and also spending categories. We have 2.7 billion cars from 2011 to 2015 across over 300 merchant categories. So that we can look at the spendings in healthcare industry, including different kind of hospitals, Renmin Hospital, Children's Hospital, pharmacies, and also other medical facilities. We also have spending, of course, on non-health sector, look at daily necessities and supermarkets as a control group. So to just give you a broad kind of a data pattern, so thinking about these are the spendings in total healthcare industry. These are the distribution of air PM2.5. So this is 20 percentile, this is 100 percentile. So air pollution is getting worse. Spending in healthcare sector increases. Look at the Children's Hospital, we see also positive relationship, Renmin Hospital, pharmacy as well. But now if you look at non-health sector, focusing on necessities and supermarkets, you actually see a negative relationship, meaning when air pollution is becoming worse, people spend more money in the healthcare sector, but less money in other in non-healthcare sector. Okay, so we argue later on this is due to avoidance behavior. When air quality is really bad, you don't go out as often. Okay, for shopping, for example. Okay, so we have meteorology data in terms of weather conditions, in particular, temperature, precipitation, wind speed, wind direction. Okay, so I'm going to skip the theoretical model, which basically shows that consumers' willingness to pay for clean air is composed of many different things. One thing, the first thing is the impact air quality A on medical spending M. So if air quality becomes worse, you have to spend more. That tells us part of your willingness to pay for having clean air. But there are other factors such as impact on productivity, on utility, all those kind of things, which we are not able to estimate, but all of those are positive. So, but we are going to focus on the first item. And that's why we see we provide a lower bound estimate of consumer willingness to pay based on the relationship between air quality and spending in hospitals. Okay, so the empirical framework, we are going to look at spending in a city C and in a time T, which is a day, in hospitals in different kind of categories. And this is the key variable of interest. This is pollution in a city C in a particular day, current day or yesterday or 5 days ago or 10 days ago, so that we can include as many legs as we want, and then there are other variables we want to control that affect spending as well, such as weather conditions and other unobserved things. Okay, so if you look at this regression from an economist perspective, as I mentioned, we really want to do a good job of teasing out the causal relationship between air quality and health spending. But if you look at this, you might worry that there might be things that are going on that affects both pollution but also outcomes, health spending outcomes, such as economic activities, such as events, those kind of things. So that would really bias our estimate of this beta, right? So we are going to use a strategy called the instrumental variable method. The idea is that really to find shocks to air pollution in a particular city, right? These are exogenous shocks, and look at what's happening after those shocks to health spending. So use those exogenous shocks to really tease out the impact air pollution on health spending. So the shocks we are going to use is really thinking about these are weather conditions, in particular wind. We know PM2.5 has a property called long-range transport. Because they are really light, they can travel quite far, several hundred kilometers from other cities. For example, if north of Beijing, the cities in north of Beijing, for some reason has really bad air quality, but then the wind also blowing south toward Beijing, it's really strong wind, then those actually, some of the PM2.5 in those cities could blow to Beijing and lead to worse air quality in Beijing. So we are going to use really the PM2.5 that comes from other cities that as a result, Beijing has worse air quality, and we are going to use those shocks as our IV. So the construction of the shock is a little bit complicated. I'm going to skip that. So that's for one. The second is that you can include up 100 or 120 variables. Those are the lagged air quality variables. But then you have so many parameters to estimate. So we are going to use a strategy that try to reduce the number of parameters, assuming those betas to follow a particular pattern of impact. So we can use a polynomial to approximate the impact air quality, the lagged impact air quality on health outcomes. So those two really empirical challenges. As I mentioned, I'm gonna skip the construction IV. Basically, we are gonna leverage really wind data, wind direction, wind speed, and figure out for a particular day in Beijing, how many percentage of PM2.5 is a result of pollution in other cities outside Beijing, right? It could be 20%, 30%, or 10%. So we basically build an air quality model to predict air quality in Beijing as a function of air quality in other cities, as well as wind direction and wind speed. So this is wind field in a particular day in China. We can translate this wind field, for example, toward Beijing if you are interested in Beijing. But of course, we do this for every city in China, and we can construct, let me see. Oh, okay. We can construct a prediction, basically, of Beijing's air quality. Okay, I'm going to skip that. That prediction has a really good relationship with our real data. So I have 5 more minutes. Let me see. Okay, I'm going to skip that. All right, so let's look at the results. Okay, so this is a regression where we regress the spendings in different categories on the current day air quality without doing any instrumental variable strategy. Okay, this is what we call the ordinary least square estimation. If you look at these health categories, these are positive coefficients, and these are non-health categories, these are negative. So this basically shows that air quality gets worse, you spend more money in healthcare sector, you spend less money in other sectors, as I showed you in the graphs, right? Now this is only for the current day. If we instrument for this variable, the PM2.5 variable, we see a much larger impact. And we also see larger impact here in magnitude for non-health categories. Okay, this suggests that you underestimate the impact of air pollution on health outcomes when you don't control for those unobserved factors, right? That's really a key departure from the epidemiology literature, which tend to focus on the correlation, right? And they tend to underestimate the impact of air pollution on health. Okay, now we look at long-term impact, where we can look at the impact of current day pollution on health spending last 3 days, 7 days, up to 90 days, right? These are the cumulative impact. So this number, 8.63, suggests that if during this last 3 months, air quality, PM 2.5 increased by 10 units, then the health spending today is going to increase by 0.8%. Okay, this is for hospitals, pharmacy, Renmin Hospital, and Children's Hospital. So again, this is OS. We do not control for the deal with the endogeneity. Now, if you look at the IV results, where we think these results are more credible, you see much bigger impact, actually 3 times as large as we saw before. This basically says, this number says, if PM 2.5 during the last 3 months increased by 10 units, then health spending today is going to increase by 2.7% as a result.
So to what extent do the various diseases associated with air pollution that you identified at the beginning of the talk
Right.
fall within this time structure?
That's right.
That is high blood pressure,
Right.
asthma, et cetera.
That's right.
All less than 90-degree kinds of 90 a day.
90 days. So that's a very good question. So our data, unfortunately, does not tell us you see the spendings in hospitals, but you don't know for what reason, whether it's high blood pressure or respiratory problems. But we believe what we capture, these are short-term, medium-term impact, mostly due to respiratory problems. Okay. So I have another study where we can actually break down disease types, where you indeed find bigger impact for respiratory problems, for cardiovascular issues. Okay. But that's really a kind of a longer-term impact, if you think about it. These are really short-term to medium-term. So I have 2 minutes. And then if you look at different health categories, you see Children's Hospital, the impact is actually 3 times larger than, is much, much larger than the general health category, which is kind of intuitive, right? Children are more vulnerable to air pollution. Okay, so now if you look at the control groups in the non-health sector, this is the aggregate non-health sector on necessities, on supermarkets, you see a kind of a smaller impact, you see a negative impact, current day and the last few days, but overall in a 3 months period, you really don't see an aggregate impact. So you see a basically short-term intertemporal substitution, but no long-term aggregate impact, okay, on non-healthcare sector. Okay. So we did a lot of really robustness checks to look at, all kind of things such as different model specifications, different IVs, and we also control other pollutants such as SO2, carbon monoxide, and other things to see whether PM 2.5 impact is affected, but really not much. Okay, so I'm going to focus on this particular bullet point here. Based on the numbers we have, we can actually translate the estimates into an aggregate number. For example, the current level of China's PM 2.5 is about 56. The WHO level is 10, right? If you do a linear projection, reducing PM 2.5 from 56 to 10, our numbers estimates suggest we are going to see a reduction in health spending by about $50 billion annually. How much is $50 billion? It's about 8% of total health spending in China in 2015. And also it's about 0.45% of GDP. So if China bring air quality to WHO standard, then the health spending saving will be about 0.45% of GDP, or 8% of total health care spending, okay? So I want you also try to remember that the number that OECD produces, that was $3 billion. That's their estimate. So ours is, nearly 20 times as large. Okay. So to conclude, we find that a 10 units reduction in PM 2.5 will reduce the number of health transactions by 2.7%, healthcare spending by 2.3%, and Children's Hospital response is much larger, and the health impact for 10 unit reduction, that's about 20%, translate to 75 billion yuan, or 11 billion US dollar annually, right? This number, I want you to contrast with these kind of goals that we have in China. So there is a national plan for air pollution control that aim to reduce PM 2.5 by 20%, actually by 2017 relative to 2012 level. That's about 10 units reduction. But if you look at WHO standard of 10 units, we have a really very long way to go. But that suggests PM 2.5 regulation would generate substantial health benefits as a result. All right, thank you.
Great, thank you so much. And now, if the audience has any questions, Shanjun, would you like to take a couple of questions? Yeah.
So I think two questions. One is I didn't understand quite follow going from 90-day observation expenditure.
Yeah.
How do you extrapolate to annual expenditure? That you make some assumption.
So the expand.
Both questions. You can tell me this.
Right.
To the extent pollution does not get subtracted from GDP,
Right.
but health spending adds to GDP.
Sure.
Maybe you have an opportunity to
Right.
illustrate another problem with GDP accounting, which is that pollution potentially promotes local GDP growth.
Right.
Maybe you can demonstrate that.
Sure. Okay, so the number that we estimated, so we estimate if China air quality is in compliance with WHO level, then the healthcare spending will reduce by 0.45% of GDP. You might think, well, that reduces GDP. That may not be good. But thinking about those money could be spent on other means or more productive ways, right? So that's really, we think that's a social, welfare loss, if you will. The first question is how we go from 90 days to annual number. The 90 days basically says that those estimates suggest if air pollution during last 3 months gets worse, what happens to your health spending today, right? So, for example, what we find actually 90 days is. So we actually go from 90 days to 120 days to 150 days. We found that impact is actually stable around 90 days. If you look at 120 days, the impact actually is about the same, meaning there is really no longer term impact on health spending, not seeing there is no longer term impact in terms of mortality, in terms of cardiovascular, in terms of cancer, but that's not picked up in our health spending data. Okay. So there are, yeah.
Hi, I'm just wondering about online purchase.
Right.
So people don't go to supermarket, but they can
Right.
purchase, go on Taobao and others.
That's right.
Do you see any
So
increase there?
exactly, we are working on that data. We actually have online spending data. So we are going to see, I think, that a increase in online spending for non-health categories. So that's type of avoidance behavior that we are also interested in, really, but that's not really the focus of the paper. The focus of the paper really is on the healthcare sector, right? Spending where you cannot do online shopping, right?
Professor, just a quick question about how you constructed the IV.
Right.
For those of us who has lived in Beijing,
Yeah.
we had this personal experience when there's a huge wind or
Right.
strong wind.
That's right.
PM 2.5 actually clears out of the
Exactly.
city. So when
Yeah.
you showed us the velocity of
Right.
wind graph.
That's right.
And my second question is,
Yeah.
it seems like some of the arrows are coming far down from south. So is there a bound of like the farthest range that
Yeah.
PM 2.5 can travel by wind?
Sure.
And how strong the wind is going to affect that?
Sure. So wind itself in Beijing is a good thing. When wind is strong, PM 2.5 tend to be lower. That's a good thing. But the IV that we use is not wind in Beijing. Rather, it's the wind in the source city, right? If there is a strong wind in Tangshan, for example, then it's going to affect Beijing's air quality more than otherwise. Okay, so we also control wind speed in Beijing by itself. That's one of the weather conditions we have in the regression. In terms of the distance we allow the pollutants to travel, we actually have a model in the first stage where we have a parameter. We estimate that parameter, which is going to tell us the decay of PM 2.5 over distance, but also over time. Okay.
Maybe last question, because I'm afraid we'll have to move on. But
Hi, thanks for a nice paper.
Oh, hi, Mary.
How are you?
Good.
I have two quick questions. One is, do you capture social spending on health? So to the extent that the hospitals are subsidized or the patient doesn't pay the full amount,
Right.
I'm wondering if that. The other is that you use a linear approximation. And
Yeah.
it seems like the effective PM5 would change over the course so that once you get close to
Yeah.
10, the
Yeah.
costs are really less than
That's right.
what you're estimating.
Exactly. So that's a good. Those are good questions. Second question, in terms of right now we estimate linear function. We really wanted to allow or have a more flexible, a piecewise linear, for example. That's something we are working on, so that we can see the nonlinearity of the impact. So the first one is that the spending through credit card, debit cards in the healthcare sector accounts for about 53% of total healthcare spending in China. So 47.3% are through cash or health insurance payment. But in our analysis, we assume the impact actually through those credit card, debit card transactions is the same as impact in terms of the spending through cash and other methods. All right? Thanks a
Thank you
lot.
so much. Yeah. All right. Is Simon's presentation there? Thank you.
Okay. First of all, thank you very much for the invitation and to be here. I'm very excited to be part of this conference, and I look forward to your comments and questions on this work, on this presentation that I'm going to, where I'm going to talk about infrastructure in China, and in particular, we're going to look at potential political distortions in the way that highway networks are designed in China. So this is joint work with Ilanin Kondo, who was actually used to be in DC until very recently, and he's now at the Fed board, and he's now at the University of Notre Dame. So we look at a particular episode in the infrastructure expansion in China, which is the National Expressway network, which expanded massively starting in the 1990s. And there was a very clear policy goal there, which was to connect all intermediate-sized cities, or all cities that have at least 500,000 people, and all provincial capitals, to connect them in a common and modern highway network. And so that led to, so that was a very clear policy specified a national goal, and it resulted in approximately 35 kilometers of high-speed four-lane highways, and it cost about 120 billion. And so this network has been studied before by others, its economic consequences, but what we are going to focus on, our broad question in this paper, is how was this policy of connecting, so these cities that should be connected were given by the policy, and our question is, how was the network that then connects these places, how was that determined? So you can think about how were the exact paths chosen, which places were connected directly and which ones not, and we're then going to ask, are there maybe distortions in the way that network was designed? So these are the cities that have at least in the 1990s had at least 500,000 people, or are provincial capitals. So these are the cities that, given the policy objective, had to be connected by modern highways. And this is the resulting actual expressway network as defined by this. It was later on, the policy was expanded to include smaller cities. But this is the network that resulted from this initial initiative to connect all cities with at least 500,000 people and all provincial capitals. So we are going to be thinking about how does this resulting network, how is this potentially affected by political distortions? And the way we are going to approach that problem is we will compare the actual network that you just saw on the previous slide. We will compare this to a optimal highway network. So we're going to design an optimal highway network and then see whether the difference between the actual network that we observe and the optimal network that comes out from our optimization, whether that difference can be explained by the birthplaces of high-ranking officials. Okay, the idea is that to test whether politicians in higher office, whether they have managed to distort the highway network closer to their hometowns. And then the second question, if the answer is yes, if there are these political distortions, what are actually the aggregate welfare effects of these distortions? And so that's kind of the second piece, and that's still work in progress. So I'll talk about that towards the end of the presentation. Our approach to answer these questions is to use a general equilibrium trade model that, first of all, allows us to make welfare statements for the whole economy, taking into account trade diversion and so on, and also that allows us to design the optimal, so an approximation of the optimal highway network, and we compare this also to other network design approaches as well. And then we will combine these networks with the birthplaces of politicians. So there's a database, China Vitai, that has the CV of Chinese politicians, and we merge these database on the Chinese, and these CVs tell us where they were born and also where they are going, where they went to college and so on, and they tell us what offices these politicians had. And we match that to our county level data or to our network data, in fact, for the transportation infrastructure. So this is just, I'm not going to say much about literature. There is a literature on the National Expressway network in China. There is a very young literature on the design, on the optimal design of transportation networks. And then there is an existing literature on the misallocation, regional favoritism, and also birthplaces of politicians in China and in elsewhere. So I'm just going to be very, very brief here. So the data that we are using is some geographical data. So we need to know, obviously, the location of these cities, of county centroids, of the birthplaces, of the capitals, and large cities that have to be connected. And then we need to know something about the topography of the country because engineering will be important for when you think about how to design, how to choose paths of highways. We want to take into account the topography, the terrain. So we have geographical data on the slope. We use income data for the places that we want to connect to know something about what is their economic size. We're going to be using luminosity data as a proxy that has now frequently been used as a proxy for income. And we have this data on Chinese politicians that we match to our network database. In particular, we're going to be we have the whole, or we have a large set of politicians in our data. For the current version, we are focusing on politicians in high office, in particular members of the Politburo and provincial governors. And also, we are coding politically or influential politicians, influential for that highway network, if they were in office during the implementation, planning or implementation phase. Okay, and we'll use a placebo indicator in case you were in office after the network was already implemented. In that case, you should not be able to distort anymore the network. So we're going to be able to use a placebo analysis as well. I will be very quick on the theory, essentially, but we need a theory, a general equilibrium theory in particular, to design a network, a highway network, and also to make welfare statements. This is I'm going to use a general equilibrium trade model that is based on Eaton and Cornell, and has also been used by Donaldson and Hornbeck in order to quantify the effect of transportation infrastructure investments. So this is a framework that I've used previously to analyze infrastructure in India, and it, like other trade models, like other general equilibrium trade models, it boils down to this key gravity income equation. I'm sorry for the typo. But this is an equation that relates income in a particular county, the O stands for origin, to its market access. So this is is, you can think of this as, without having to focus too much on the each variable, this is market access, how well you are connected to other places in the country due to the transportation infrastructure. Okay, so this is going to depend on transportation infrastructure. So you think of this as the income of each location, and what we are going to do for the network design algorithm, we're going to choose highway connections that maximize this income in the channel equilibrium framework. And we calibrate the whole model using estimates that I've derived in previous work on India, where we can take these estimates from that work to calibrate the model. Now, what does the highway network design algorithm look like? So again, an important part of this project is that we want to compare the actual network that we say is potentially distorted for various reasons, and in order to quantify these distortions, we compare it to the optimal network, and we therefore want to kind of start with thinking about how we design an optimal highway network. So that's something I've done already in this other paper that I mentioned on India. The basic idea is actually coming from what people have used in physics already, network design algorithms. So Gostner and Gostner-Newman have used a heuristic approach to design a highway network, and I'm combining this here with a channel equilibrium framework. The basic idea is the following. Think about, you start with a full network where every city is connected with any other city, and then you take out one of these links. And so for that full network, you compute what is the cost of building that network. It's going to be a crazy expensive network. And you compute what are the travel costs through that network and what are the implied incomes. Okay? And then you remove one of these links, recompute costs and benefits, and kick out the least beneficial links. And you keep iterating until your network converges to a situation where marginal costs and marginal benefits are equalized. Let me give you a visual representation of this. So you start out with a network where everybody is connected with everybody. Some of these links that you see here will be very costly and not very beneficial economically. Okay? We figure out which of these links are not very beneficial by iterating and removing each one of these sequentially. And then the least beneficial links, we take them out of the network, and then you end up with a slightly smaller network. And then we actually check whether there are any links that you could add. But then again, we ask the question of the remaining links, which ones are maybe are more costly to build than worthwhile economically. So we can make the network smaller and smaller iteratively by removing the least beneficial bilateral links until essentially marginal costs and marginal benefits are equalized of the marginal highway. Yes.
This calculation assumes neighboring countries do not exist.
Say again?
This calculation assumes there are no neighboring countries.
This is a closed, yes. There's no international trade here yet.
Cities around the border.
Yes. So and also international trade, both kind of on the continent, but also you can think of trade through the sea, is not yet part of this model. But I can potentially, so the way to bring that in, and I look at that a little bit in the other paper, is to kind of add market access to these places at the border that have access to international markets. So that is in principle feasible to do. But it's not yet part of that model. That's a good point.
The implication is some of the near border links should be there, will not be considered.
Yeah, no, that's very true. I mean, in principle, the approach can be extended to larger areas to think about kind of more a regional network as well that optimizes over a broader area. So this network kind of gets reduced until the marginal costs are equal to marginal benefits, and this is the approximation. I say approximation because this is a heuristic algorithm, so there is no guarantee that this is there might be another network. So it's a local think of it as a local optima. But this is the result of this, and you can start with you can use different starting points to address that problem, and it seems very robust. This is the resulting approximation of the optimal highway network in China. And this is now adding the actual highway network. So in red, you see the actual highway network, and in orange, you see the approximation of the optimal highway network. So we see that these networks are actually relatively similar, but the optimal network is actually a little bit smaller than the actual. But there are deviations in terms of how the paths are chosen and also which cities are connected with direct links. And the name of the game is now going to be to see whether we can explain the difference between the actual and the optimal, whether we can explain it with the birthplaces of politicians. This is going to have two parts. There's first going to be a reduced form estimation where we just try to see is the difference between the two networks, can it be explained by the birthplace of politicians? The unit of analysis here is a county. For each county, we measure the distance, that county's distance to the optimal network and to the actual network. So if you are very close to the actual network but far away from the optimal network, that means you have a large deviation. And these equations simply, we can test whether that deviation can be explained by political access, which is whether it's a birthplace of a politician who was in power during the planning and implementation phase of that network. Now, when you see that equation, you might have one key concern, of course, is that unobserved heterogeneity. Okay, so the places that were connected might have more politicians, but might also be more worthwhile to connect for other reasons. So think of a university, for instance. It might be that a birthplace. Thank you. It might be that a birthplace, or might be that a particular county is the birthplace of many politicians because they have a great university, and also it makes economically sense to connect that city because there is a lot of economic potential. To address that problem of unobserved heterogeneity, we can exploit the time variation. So in this concern I just explained, even a politician who was born or who's in office after the network is already completed should still show up as a positive correlation. So that's going to be our placebo treatment, and we can with that we can kind of address this concern of at least that channel of unobserved heterogeneity. So this is what we find in the reduced form. Let's focus first on column 3. So in column 3, we request the deviation between the optimal and actual network on a dummy, whether you are an index actually of political access, and we see a positive association, and we control for distance to the optimal and a bunch of other controls. And then in column 4, we add this placebo indicator. So this is whether you have a politician who was in office but after the network was completed. So this one should not show up significantly, and it does, and it actually does not. The other columns to the left and to the right are alternative ways to design the network that, for the sake of time I'm not gonna spend much time on. So now the last piece will be to think about how can we quantify the welfare effects of this distortion. So the reduced form estimation tells us that there is this relationship between the deviation and political access. We already know from earlier, or actually I skipped over this, but the difference between the actual and the optimal network is a 0.75% of GDP. So we would gain a little bit less than 1% of GDP when implementing the optimal network versus the actual network. But of course, not the entire deviation between these networks is explained by politics. It's only one fraction. So a key challenge is how to actually quantify the distortion that is due to political access. And to do that, we're going to go back to the general equilibrium model, and we're going to use the general equilibrium model to compare two types of transportation networks. One is the optimal network that I've already shown to you, that optimal network that maximizes aggregate income net of road construction cost, so it takes into account the road construction cost. And then we compare that to another network where we also run this optimization algorithm, but we force the algorithm to connect also the birthplaces. Okay, so we rerun our optimization network to say that now we also have to connect these birthplaces, and we can then compare the welfare difference in those two networks. I've already mentioned this. So here is a quick graphical illustration of these birthplaces and networks. What you see in black, the black thin line is the actual network. The thicker red line is the optimal network, and the green dots are the birthplaces of these core politicians. So we rerun these optimal the algorithm design to get at the optimal network by forcing it to also connect the green dots. Okay, so to force the algorithm to be part of that network, and then plugged it into the general equilibrium framework and figure out the welfare effects. So this is work in progress. So we're still kind of working out the details. What we have so far is about 0.1%, so about approximately 1/7 of the total distortion that we see between the actual and optimal network can be attributed to the birthplaces. So that's kind of at least what we have so far, but this is still somewhat a work in progress. So let me conclude. So what we do in this paper is we compare the actual highway network to the optimal highway network in China using a general equilibrium framework. And the actual highway network and also the optimal has the objective of connecting all intermediate-sized cities. We find that these two networks, the actual and optimal networks, actually have relatively similar structures, but the exact paths differ, and we find that the difference between those two networks can partly be explained by the birthplace of politicians, and we are working on the quantification of this aggregate distortion, and so far find that approximately 1/7 of the overall distortion, which is about 0.7% of GDP. So by the way, I should say it's 0.7% of GDP each year. So this is a big number, 0.7% of GDP in China each year. So it's actually a very sizable effect. About 1/7 of that is attributed to the birthplace to these political distortions. Thank you very much.
Great, thank you so much. Unfortunately, we're a little short on time, so maybe we could take 2 or 3 questions at once, and then we could answer. Sure.
Thank you for the interesting paper. One of the key questions here is how, maybe I missed that, but how to calculate the optimal network highway. Have you considered something like a geography, the history? Because maybe there was a highway there. It's just upgrade of the existing one, right? And there may be mountains and rivers, this kind of geographical factors. Have you considered that when you calculate the optimal network? Thank you.
Sure. One more question over here.
So you have actually considered about the birthplace of the politician, but what if actually they kind of moved around, like where they're actually grown up? Those kind of factors is not actually in there in your presentation.
And then one more, and then we gotta move on. Sure.
I also have a question about the birthplace. So I noticed that the birthplace of the politicians is actually the very popular cities in China. So like those cities, they just have large portion of the people. So that might be one of the reasons that there's very high effect on it.
Thank you.
Okay, thank you for all these questions. I'm going to start with the first one. So yes, it's important to take into account the geography. So we have information on the slope of the terrain, so mountains and so on. And we take an equation kind of coming from, or we map the slope of the terrain into a road construction cost index. So what the algorithm does, it actually finds, when you want to connect two places, it finds the cheapest way, from an engineering perspective, the cheapest way to build a highway to connect the two places. And we know, based on the slope, how costly that is going to be. So the geography is part of this optimization algorithm. So what the algorithm does, there are the benefits of connecting places, which are the increase in trade and gains from trade, and the costs is the road construction cost, and that's where the geography comes in. So that's very important. It's true politicians move around. There's actually a lot more information in the data that we could exploit. So we are now focusing on the birthplace, so whether there is kind of regional favoritism to their birthplace. But we know what offices they have held, who they shared an office with. So they may have served together with someone else on the board. So we can actually look at the network effects among politicians. All of that is there in data. We just haven't exploited it yet. So we started out by looking at the birthplace. The third question was about politicians are from large cities. That's true. But what our network design algorithm does, it wants to connect larger places as well. So the network design is going to give preference to economically more powerful and more populous places. So what the politicians do here is that they, given that you kind of have to connect places that you would not otherwise connect if they are not sufficiently economically worthwhile. But it's true that many of the birthplaces, they would be part of the optimal network anyway, just because they happen to be important in large cities. That's definitely good. That's going on.
Well, thank you so much.
Thank you.
Interesting.